Well, from the moment he was born, the doctor who received him at the hospital said he heard a murmur, at which point he thought he was really severe, so he suggested us to go to our cardiologist, who then performed an echocardiogram and an electrocardiogram, and he was able to diagnose that Nicholas had a severe pulmonary stenosis.
He had at birth, was diagnosed to have a severe heart condition. He had two major problems. One was that his valve, one of the valves in the heart was severely narrow and tight, and he had a hole in the heart.
When we approached Health City from the very start, they were very flexible. They didn't even require for us to translate documents from Spanish to English. We had a conversation directly with the surgeon, which was Dr. Benoit. We scheduled a Skype call, and we talked with the anesthesiologist, with the pediatrician, and they concluded that the operation was fairly simple, that they can do it here, that they've seen a lot of Noonan syndrome kids, and that shouldn't be a problem. They quoted me the price, which was very, very, very decent, a tenth of the price that we got on an average from all other hospitals. A friend of mine called me directly to my phone, and he said he came across Health City, which took them, and they embraced his kid. They brought him over and they saved his life. So that was the last signal that we needed for us to come here.
So I did the evaluation at first, and he had severe valvular stenosis. It's called pulmonary valve stenosis, both above and below the valve and the valve. And also he had a hole in the heart, that is atrial septal defect. And we explained, me and Dr. Benoit, together we explained that what are the stages of surgery, how will be the recovery, and also they expressed concern about the infection post surgery. And we assured that our infection in the hospital is very low, and it will be taken care of.
The surgery was a complete success. Dr. Benoit and Nicholas and God were able to get him through the surgery, which took about 6 hours. We just got out of a meeting with Dr. Benoit, and he informed us that before the surgery, it was very likely for Nicholas to have a second surgery, for him to be replaced the valve. But fortunately, that wasn't necessary because Nicholas never lost the valve. So we hope that this is Nicholas' last surgery, and that the problem was forever solved.
Both the problems are now fixed. The valve is open and the hole is closed. The hole is permanently closed, so there is no question about it. He'll be fine for the life. The valve, a very rare chance that there is less than 5% chance that the valve can again become stenotic or become tight, but 95% he should be fine for the rest of his life.
The quality service, the personal treatment that you have with your doctor, with the actual surgeon who was at the operating room, you don't get that anywhere else. And that's why this is so valuable.
So it is all because of the team here. It's not one person or two persons, it's the team. We have an excellent intensive care, anesthesia, and the nurses, especially the nurses and physiotherapists. Everyone in the team is very important. They play their role to their best of capabilities, and as a team, I think we are doing good work.
I'm so happy. I feel blessed. Having my child here, it's amazing. I'm more than grateful and blessed for everything.